This time on Dr. K's Exotic Animal ER.
Oh.
A deathly sick rabbit jets in from the Virgin Islands. An abandoned baby macaw may lose a wing.
Oh, you're just terrorized. Oh, my goodness.
I don't know yet whether it's salvageable. It has to be amputated.
And a sassy chicken has a mysterious limp.
Strut it up, girlfriend.
What is going on?
After Hours brings in an emergency. Oreo the bunny hasn't eaten or pooped in 2 days.
Oreo's owners actually flew in here from St. Croix in the Virgin Islands. There was really no veterinary care available for the rabbit there. They don't have access to a lot of the medications that we use in rabbits, and they don't have the experience that we do in rabbits. So it's really quite humbling to have somebody fly from that far. Now the pressure's on to not let them down. Oreo is in very critical condition. With him not wanting to eat on his own and us trying to figure out, well, why did he even get this sick in the first place? Because he's really sick. I wanted to do an oral exam under anesthesia to have a really thorough oral exam. Okay. Oh, my goodness. Oh, no. It smells bad, I know. I know it smells bad. My goodness. Oh, oxygen, just Valium. That's right. That's right. We're gonna box you down. Oh my goodness. Shh, 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 shh. Just hide. Oh my goodness, we need a little Valium. Oh, you poor little thing. Ooh. I was so afraid he was gonna drop dead in my arms.
Just tried to jump out of your arms.
Well, the screaming, it's kind of bad. So you're just like, bail. I wanted to do an oral exam under anesthesia, and that just stressed him out too much. You just don't do that with prey animals. You just stop, turn off the lights, bail out. No more stress for this animal today. Period, that's it. We're good. You didn't die. That's very good. Whew. Poor little thing. Poor little bunny, huh?
Oreo's coming home with me tonight. We're gonna maintain him on fluids. He's extremely fragile, and this is a service that we do offer to our more fragile patients. This is the bunny that came in from the Virgin Islands last night. This is Oreo.
Okay.
He's been on fluids through the night. He drinks, but I haven't really seen him eat.
Right, okay.
Late last night, we came in to Dr. K. Oreo was totally unresponsive, laying flat. He hadn't been eating, hadn't been pooping for 2 days. We were very nervous. We knew that we needed to bring him to an expert, which Dr. K is.
Let's see Oreo.
Sure.
Oreo.
Since we were able to charter a plane, it was very easy because he was actually on a little air ambulance, but normally for people. I was terrified that he was going to die in the flight, and all I wanted to do was actually to get him here.
Last night we had a bailout on doing anything with Oreo under anesthesia because he was just so panicked. So today we're going to use a little bit of a sedative to start with and hopefully get the information that we need. All right, honey. So noogie your head and just kind of, prey animal, very stressed. It's all right. So what we found on the radiographs is that his intestines are filled with more gas than is normal for a rabbit. The blood work showed that he is extremely, extremely dehydrated. His kidney values were so high, it was above analyzer range on our machine. We actually even had to do a dilution to get an actual number initially. Interesting. When I see numbers this high, this is the scenario where this rabbit could easily die. This is gonna be really touch and go.
All right, there you go, bunny boy.
I'm really concerned about Oreo. I'm really worried that he's going to die.
While Dr. K and Dr. Matt come up with a treatment plan, concerned owners bring Shakira, the diva chicken, in to see Dr. T.
Shakira, 3-year-old chicken.
I know a lot of chickens named Shakira,
Do
actually.
you? That's really funny.
Yeah.
Shakira, she is a Baird Rock chicken. She looks loaded per the owner, and she's been limping. So we're gonna have to go take a look and see what we can do to help her. Hello, hello. She's gorgeous.
She is.
I let them out of the coop this morning, and I noticed that she was limping, and my sister pointed out that she was looking a little chubbier than usual.
And we don't know if she's laying personally or not. We have no idea.
Nope.
With chickens, before we do anything, I always think reproductive disease. So common. So I'm just gonna take her out and I'm gonna just see which leg she's limping on, because that'll actually help me deduce what organ could be causing her to limp. Sometimes whenever they're here, the limp miraculously goes away. Because they're like adrenaline's all crazy and geared up. So we'll see if we can witness that. I know, baby girl. Thank you for helping.
This all started, we went to camp in Maine, and we got little chicks, and I fell in love with one, and she stayed on my shoulder, and I said to my husband, I'm not leaving her here, we have to bring her home. And he said, okay. Chickens are very social, so we wound up getting a second one. And we drove home from Maine to Florida with 2 baby chicks in the car, 4 daughters, my husband and I.
Strut it up. Strut it up.
She's lost. She's like, what is going on?
Do you recall what leg it was off of?
Nope.
Well, it ain't broken, is it?
No.
Come here, sweetie. I'm gonna put you on here so you don't slip. Can we see in the mouth? Yeah.
Yeah.
Good girl. I'm sorry. They hate that part. That's like the worst. It's like the worst for them.
They're all divas.
We have Taylor, Aretha, Shakira, and Beyonce.
I love it. That's great, guys. That's great.
My poor husband.
Queen Bee here, huh?
All divas, because we have 4 daughters in the house and my husband's the only male. It's nice because they're our pets. My husband's in love with them, and it's a pet that gives you something back. And they're very sweet. People really don't understand chickens. Like, you could pet them, you could talk to them, they'll follow you around for food.
Yeah.
It's very cool. It's very nice that my kids got to grow up watching other animals besides dogs or cats. We are very, what do you say?
Environmentally conscious.
Environmentally conscious.
She's doing really good. Her heart sounds great, guys. Just listen to her lungs extra long. Sound very clear, baby girl. You don't have a respiratory infection. But do you see every time I touch her?
Yes.
It's painful. And I'm going like this, like barely touching her.
Okay.
So I do think there's something going back here. She's probably limping from what's happening in her belly. Nothing that's wrong with her legs, because if there's something wrong with her legs, she wouldn't have jumped.
Okay, so like what else could it be? An infection?
Cancer or something in her belly.
Okay, I shouldn't have asked.
There's quite a few diseases that cause chickens to go lame on one leg. There's a bunch of big, really scary diseases out there. However, I want to take an x-ray first to rule out that she doesn't have an egg compressing along the nerve that runs on the side of her leg, causing the limp. Can I steal you for your pictures? I'm gonna hold you so I don't have to anesthetize you, okay? You'll be good. I'll be back.
Thank you.
Yep. Come on, sweetheart. Let's do it.
Ay, ay, ay.
Wow, Shakira. We're blessed with your presence here.
Oh my gosh, our chicken names are cute. It's Shakira, Adele, Aretha.
That's cute. Come on, Shakira. I'm gonna take some x-rays of you. All right, ready?
Yep. She's a big egg in her belly. What I'm taking the time to look at is to make sure that she looks healthy in order to lay the egg. So I'm taking a look at her bone density. When you look at these bones right here, you can see a nice white line with the gray in the middle. It's completely normal. And then I'm looking to make sure the egg is in the normal position and it's well shelled. So the little taper part should be down here. And it does look very well shelled. It has a very nice, crisp calcium outline. Everything's looking very good. So I hope she'll just be able to lay this on her own. She is a big old egg. Her belly is distended because she has an egg in there. And a lot of the times it gets distended with the reproductive tract. And sometimes the reproductive tract secretes a little bit of fluid and that can accumulate. It's all normal things.
Okay.
The good news is the egg, it's in the right position to get laid.
Good.
But she's obviously having difficulty laying it, or she wouldn't be limping and acting off.
Yes.
So what I want to do today is supportive care. I want to give her anti-inflammatory to help her with any kind of inflammation that's getting associated with her trying to lay, and then help the nerves a little bit. And then I want to give her a vitamin injection and a calcium injection. After that, I want you to take her home and let her be completely normal. If she doesn't lay egg in 24 hours, we're gonna have to manually remove it.
Shakira, the diva chicken, is racing the clock to lay an egg.
I want you to take her home and let her be completely normal. If she doesn't lay egg in 24 hours, we're gonna have to manually remove it.
How do we know if it's her egg that she laid?
If you have to keep her separate, then do that.
Okay.
And honestly, if you weren't such good owners, she might have just laid on her own soon, but we're not gonna take that chance.
Oh, you know what? She's part of the family. She's not a chicken, she's a pet.
She's a pet, absolutely she is.
She's a pet.
I know, Shakira. Oh, stop it. Stop.
It's okay, baby girl. This is gonna make you feel better, okay? So that's the Metacam. And this is the calcium. I'm gonna split this.
It's like, whatever.
She really didn't care, did she? Oh my goodness, baby girl, you did good. Let me rub your chest. Oh, I know. So I just gave her calcium, vitamin D, and Metacam, which is an NSAID, to decrease some of the inflammation associated with her trying to lay that egg. So fingers crossed Shakira passes her egg along. She has 24 hours. You did good, my friend.
She's extupated.
Extupated. Goodness gracious.
Hopefully it'll pass by tonight.
I hope so.
What's up? Oh my gosh.
Oreo the bunny's owners anxiously await some news about Oreo's condition and prognosis.
Oh, wow. He looks so much more alert.
Let me pass you your bunny.
Oh, hi, honey. Oh.
Oreo's kidney values are very high, and I'm still very concerned, but it seems like we've stabilized him for now. We just gave fluid under the skin last night. I think overall he is looking better. Well, first of all, we want to make sure his numbers come down.
Right.
Basically, it's going to require some fluids under the skin, and he's losing more than he's taking in at this point due to his kidney disease.
So he's peeing more than they are supposed to pee a lot, right?
Well, they're just not supposed to pee more than they drink and get from their food.
How do we manage this going forward? Does he need to be on medication?
We can manage him from check kidney values every so often.
He says, oh, Mom, what are you doing?
He's a lot happier here. I do need to check urine on Oreo because that's the only way for me to know if the kidneys are functioning. If they are, then his abnormal values are probably just due to severe dehydration.
Look, oh, wow, look at him. You should get a video of that. Dad will be very happy to see him moving around. He was originally a meat bunny, as they call in St. Croix, so he was bred to be sold for meat. Unbeknownst to him, he got into a little scuffle with his brother, and his brother bit off one of his testicles. And so they couldn't bring him to the ag fair.
Okay, so his life got saved?
His life got saved by that, and then we heard about him, and then we took him in. And as soon as I had never heard of that meat bunny. He says he doesn't even like to hear it. He said, that's so awful. He's a very loving bunny. He likes to be cuddled. He's very, outgoing. We are very attached. We have a big routine. He doesn't get fed pellets. He only is fed vegetables and lettuce and hay. And
Bunny eats better than me, for sure. Yeah, he's a love bug.
He really is. To my husband and myself and my youngest who rescued him, he's very loving. To everybody else, he can be a little bit ornery. He's been known to box. You know, that bunnies where they box people. He can be a little skittish.
Well, I mean, I would be thrilled if he started to box me. That's what we want to see. So his kidneys are still trying to work it out. We have to provide him with IV fluids now for the next few days in the hospital.
Hello.
Brody, a baby macaw, comes in with problems with his right wing.
I'm gonna take him in the back, get a weight, and have Dr. K take a quick look.
I just covered him because he just seems to be quieter when he's covered.
Okay. This is your baby macaw.
Oh, baby. Let's see.
you're just terrorized. Oh my goodness.
I know.
Little thing. Oh, it's a child. Brody is a baby macaque, and he's very, very, very skittish. To me, he acts like a baby macaque that's been raised by the parents. I don't think he's been hand-raised. Hold him steady. He's gonna...
Okay, buddy.
Hey. Oh. Oof, look at this wing. That must be absolute agony. Hold him steady. He's gonna...
Okay, buddy.
Hey.
If only Brody, the baby macaw, could speak.
Oh, you are broken. I can immediately tell that this bone is broken. You can tell by the way this wing is hanging, and when I palpate the wing, you can feel the broken ends. This is extremely painful. Just as soon as you touch it, he reacts. That must be absolute agony.
I brought Brody in today. We run a wildlife sanctuary, and we got a call about a baby blue and gold that was recently purchased. The owners were trying to hand feed him, and he jumped out of their hands.
Oh, my goodness, you big old dinosaur.
Our organization basically takes in all kinds of exotic animals that people either don't know what to do with or they no longer can keep them, and they rehome them, and we take them in.
That hurts, I know. You know what I'm gonna do straight away is just put a wrap on that just to immobilize it. This little guy's in a tremendous amount of pain. I want to give him something for pain immediately, and then I want to immobilize this wing as fast as I can. By that, I mean to bandage it to his body. That stops the broken ends from rubbing on each other and help relieve his pain dramatically.
Oh, it's okay, buddy.
Where's Dr. Matt? Can I show you a trick for figure 8?
Oh, man.
I know. Oh, we still got the baby lips. He's probably only about 8 to 10 weeks. So what I like to do for figure 8 bandages, if you do this, if you cut a slit in the end first, then you hook this over the shoulder like this. Your objective is to stabilize the wing. And then I just want to go once over the other wing and once under the other wing. Shh. There. Oh, you're gonna feel a lot better in a minute. Oh, I know, honey. Poor thing.
I just feel bad for him. I mean, he's only 9 weeks old. He's gonna be sitting there with probably pins, who knows.
Just let go. I just want to see. Oh, you're just upset. You're not a bob, all right. The bobbing response is when you have a baby bird, and if you just touch at the corners of their mouth, usually they will instantly start to bob their head as if they're gonna be fed. He's not doing that, and it's probably because he's just in so much pain that every other sensation would be distracting.
Oh, I know. Oh, my goodness, I know you're so upset. It's okay.
All right. I gave him something for pain immediately, just to calm him down. Yes, it's fractured. It's the humerus, the upper wing bone there.
Okay.
Fixable.
Which is the most important thing.
Yeah, exactly. It would require a surgery where I put pins that would be on the outside and then attached by a bar. It's always ideal to get a perfect surgical repair on a bone, and that's what we'd like to do every time, but you have to tailor it on a case by case. This is a pneumatic bone, which means it's an air-filled bone. There's risks for infection, there's risks of death under anesthesia, and this would be a very advanced repair to do. First thing I'd have to do is just take a quick x-ray and see exactly how the fracture is laid out to make a plan what it would be to fix it.
Okay.
Are they gonna just let you have the bird, or do you know the status yet?
I've taken full responsibility for him.
Oh my goodness.
They didn't know what to do. They were like, where do I take the bird?
Who's selling a baby bird that's not weaned yet these
They
days?
got it from a pet shop.
Just bums me out when they're selling unweaned birds. It's hard. I don't like to see unweaned birds in the pet trade. I think they do better if they're with the parents or with a person who has a lot of experience with hand feeding. It's not uncommon for us to see unweaned baby birds bought as pets. The best thing in the world for this bird is that Armando is overseeing his care. He is phenomenal. I'm a sucker for a macaw. It's all good.
I know you're the bird whisperer.
I love my
Well,
little macaw.
bunnies is your thing, but
Oh, I love my birds. I'm not about my birds.
Yeah.
When I first got out of vet school, I wanted to do only birds. It's
I
all good.
really appreciate you taking
No
the time.
problem. Let me start with the films, and we'll just get
All
a
right.
plan of what's broke, where it's broke. We've got some pain meds on board now, and we're gonna go ahead and take the radiographs on Brody. Fingers crossed that he's not gonna need surgery. Oh, honey.
How old are they when they start getting their pretty feathers?
Pretty young, 6 weeks. He's just a child. They grow incredibly fast.
He's big.
I think they're one of the few animals that get cuter as they get older.
Come here, buddy. Breathing okay?
Yeah, he's doing good.
Oh, okay. I think I make my staff a little crazy because I'm always hyper vigilant. With exotic pets especially, they can die very quickly with no warning signs.
All right, little bird.
All right, let me show you. He's broken. That's the fracture. Now, honestly, looking at this fracture, it would be a completely legitimate choice and not a bad choice at all to manage him just in a figure-8 bandage, okay?
Really?
It would, and this is why. They heal incredibly quickly.
Okay.
Birds in general form calluses on broken bones
Super quickly.
incredibly fast. So if he's fine and it's staying in place, then we can, just recheck him at like 7 to 10 days-ish.
Okay, I'm glad to hear that.
If I went ahead to do surgery, you're dealing with a tiny bone fragment at the top that's literally only this big. That's not a big enough piece of bone to get an effective number of pins in it. There is a possibility of causing more damage than good by trying to go in there surgically.
I'm really glad that the outcome is what it is. and
Yeah,
you don't have to be so invasive.
yeah, exactly. It's the best, and it's not shortcutting me either. It's really not. If
plan
this
of
was my
action?
own bird, I think this is what I would do. Really,
All right,
I know that's
cool.
what I would do.
I know if it's
This
coming
is-
from you, I feel very confident.
The outcome for Brody is probably going to be that he's not going to be able to fly, but he will be able to at least have this wing in a functional enough posture to be able to perch and not having it drooping and tripping over it. So I think he's destined for a pretty decent life.
Knowing that all we have to do is just keep the bandage on there, bring him in a couple days to get it checked out, and then go from there, I'm super happy with the outcome.
Oreo the bunny, in from the Virgin Islands, is alive, but not out of the woods yet.
Kristen, have you seen him nibbling on anything yet today?
Not today. We haven't gotten to get him a fresh salad yet. He's just been fairly angry about the treatments.
Right. We still don't know exactly what's wrong with Oreo. We're about to get some new blood results, and I'm really concerned. Any animal that's dehydrated is going to feel very weak, and in an herbivore's case, their GI tract becomes very dehydrated, and then it slows down. And that's what we call GI stasis, which honestly is life-threatening in a bunny like Oreo.
Oreo the bunny from the Virgin Islands is in a serious condition, and the team is doing everything they can to save him.
BUN is down again from 98 yesterday to
solid.
52.7.
Yeah, maybe we'll just do
Still
one
not
more.
normal, but still coming down, even off of the IV fluids overnight.
I'm really relieved that Oreo's kidney values are improving, but I am concerned that he's starting to have some gut problems now. I do believe that the gut problems are related to his profound dehydration. I'll put another dose of sub-Q fluids on there for him. So we're gonna introduce some new medications to hopefully get Oreo's gut moving again. So in the next 12 hours, I'm really hoping to see Oreo start pooping and feel less gassy.
What are you doing there, baby?
Owner Armando returns with Brody and a recently rescued pet.
Brody came in today for a recheck and a rebandage. I also brought in Raja, a kinkajou that owner was tired of taking care of her.
Come on. This is Raja. She's in for a wellness exam today.
You're very cute. All right, let's see the bye-bye. It's always a question to make the right choice, but I really feel comfortable about going at this case with a bandage instead of a massive surgery. Just so you know, what I'm looking for is that this wing, stay up.
Up like this.
Yeah, I just want it nice and high so that it's not curling in on him.
Let him go.
Let's let him take a break. Yeah, did he eat already this morning?
He did.
Okay. Brody's looking pretty good. He's still upset, and I don't think he was handled a whole lot prior to having been sold. So he's not a calm baby bird, and that's complicating him in how he stays situated and deals with the wing being bandaged. We're not out of the woods yet. A lot is going to depend on Armando helping to keep him calm, and just hoping for the best that this will heal well.
He's now a little more attached than he was when he first came in. He's been a 24-hour-a-day, 7-day-a-week project. We're going to be coming in every 4 to 5 days, checking it, and then rebandaging it.
Okay.
Now let's look at the kinkajou. Raja is 4, correct?
Yeah.
She's been with you for all 4 years? Oh, that's perfect.
No, the owner was tired of cutting up fruits and veggies for her.
Oh my God, that's really the complaint?
Yep.
She's so funny, I love those noises.
Her demeanor during the day, as opposed to night,
Oh God.
is like
oh,
literally
night and
day
day.
night.
Yeah.
During the day, she's super cranky.
Oh yeah. Well,
And at
'cause-
night, she's a love bug. She's
Oh,
like,
yeah.
hold me, play with me, carry me,
Oh,
let
that
me
makes-
sleep in your lap.
And they're so nocturnal, so that makes sense. Obviously, you know you have to have like an obscenely large enclosure. for
Well,
them.
she's got an entire room. I mean, it's
Oh,
like 3
lovely.
times this size. It's been interesting. I'm starting to get to know what her likes and dislikes are, and we're trying to get to know one another. It's been challenging. One minute she's friendly and wants to be petted. Next minute, you do something that triggers her, and she just goes in on you. What did you find?
Whatever, it's
What did
preventing
you
her from wanting to bite
find?
me.
Well, yeah, she got me a couple times, but she's not an outwardly aggressive animal.
No.
She just doesn't like when you manipulate her to do something she doesn't want to do. That's when she strikes.
You want to come to me? I like you a lot. You smell very good. Yes, you do. Oh, it's okay. Kinkajous are interesting little creatures. They are nocturnal. They have that really big, long, prehensile tail, which is kind of cool because they can use it as their like extra leg. Kinkajous need a lot of space to be happy in captivity. Also are really, really social, so it's best to have a couple, and they have very specialized diets. So there's no wonder that Raja's previous owners actually abandoned him. Unfortunately, kinkajous are not something I recommend to most people to keep in captivity. Can I listen to you? Oh, you're precious. Okay. Can I listen with this? We'll listen to it in a minute.
She gets into her little modes.
Raja is absolutely adorable. She's this petite little kinkajou. She is very sweet, but she is very sassy. So you gotta make sure that you're paying attention to her body language and you're reading her very well before you make any kind of motions towards Raja. Can I look at your parts? I know, she's gonna take it out on you, sorry.
That's okay. I've learned, like, when she goes into that little, like, I'm gonna get you mode, I just do this, and I don't get any fingers bit.
Oh, good. Yeah, she looks great, honestly. I would really like to listen to her heart if she'll let me. I know, can you see this? It's not scary.
If you want me to grab her by the back of the head, I could.
Yeah, maybe just one time. Come here, honey.
You're a good girl.
Sounds perfect. Okay, you can go down, I'm sorry. So we just took a look at Raja for her wellness exam. She looked very, very healthy. But it's really important that she gets vaccinated because Raja is in a situation where she is exposed to a few different other animals. So we don't want to take any risks with this little baby.
It's okay. We're just gonna hold you for a minute, give you vaccines, okay?
Like, oh, no.
It's not gonna be fun, I'm sorry, but it'd be good for you, okay?
The stimper is going in the left hip. The
Good
canine.
girl. Oh.
Oh, she did so good, honey bun. Oh, look at you. Thank you so much.
She did really good. Usually the ferrets are like pee everywhere, poop everywhere. I absolutely loved Raja. And equally, I loved Raja's owner. He really just bleeds for these animals. He absolutely loves them. He's such a sweet guy, and it makes the appointment just so much more enjoyable.
All right, baby girl, let's go back.
She's a little bit of a brat, but she's gonna be a happy brat. I definitely won't mind cutting up fruits and veggies for her.
Oh, of course not.
These animals, I mean, every single one of them comes in with their own quirks and their own conditions, but every single one of their lives matter, and we do everything to facilitate a clean and loving environment.
Dr. K checks in on Oreo the bunny.
She just looks a little fragile, doesn't she? So we are on day 3 of treating Oreo for severe dehydration. Oreo is improving dramatically. His numbers are coming down nicely. His urinalysis shows us that his kidneys are still functioning, but we're still concerned about gut stasis. I'd like to see some poopies.
He did. He pooped last night. Big mushy poops.
I promise you he pooped. I mean, they may not be the biggest poops
I'm
in the world.
obsessive. They call me the poopy police for a reason. So Oreo's turned a corner today. He's finally passing some poop. Veterinarians get very excited when their patients start passing poop, and especially with rabbits. When they've been in GI stasis like this is a very, very good sign that he's turning around. How's the big business? Anything coming out? Oh,
look like a whole lot.
There's something, a little something in the box.
Yeah, he's starting to poop, and
Oh, he's in the box.
he was
That's
eating
cool.
real good.
You are feeling better, aren't you? Right?
Yeah.
Excellent.
His prognosis at this point is good. He just doesn't like me.
Dr. K,
Yeah, I'm right here.
an emergency walked in.
Species?
Bearded dragon, they don't know if it's alive.
We have a bearded dragon named Pascal that was given to us about 6 months ago.
Oh, get the Doppler. Run, 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 run.
My mom noticed this morning that she wasn't moving.
Her rate's like 30. Her heart rate was only 30 beats a minute, a third of the normal heart rate. So all you can do is keep them warm and intubate and ventilate. That's all you can do. Here, grab that. I'll open that. Oh, my goodness.
What is that? Oh, God. Oh, God.
Dr. K, an emergency walked in. Bearded dragon, they don't know if it's alive.
So all you can do is keep them warm and intubate and ventilate. Pascal presented today moribund, which means you can barely tell if they're alive or dead. She wasn't breathing on her own at all.
What is that?
So I opened her mouth to get a trach tube into her, and it's worms, penistomes.
Oh, God. Oh, God.
Penistomes.
Is that a lungworm? Penistone?
Yes, penistomids. They're essentially a lungworm, and it's a very, very grave prognosis once they get to the point where they're literally crawling up out of the trachea.
Never seen that before?
In snakes, yes. This is in for now. I don't think it's gonna make a difference with this guy. Okay. Whew. That had a serious heave factor to it. Go ahead and turn the flow rate up. There's probably more worms clogging his airway because this is not, I can't move any air at all. Okay. Where's the owner?
C1.
Got it. Hey, good morning. This is extremely serious with Pascal. There's actually worms blocking the trachea.
Oh, gosh.
Yeah, I literally pulled a worm out of
my
his trachea.
gosh.
Penistomes, which I have not particularly seen in this species. It's usually something we see in snakes. Has he been ever housed around snakes?
No. Well, we've only had him now for 6 months.
Okay.
He was given to us from a friend that couldn't take care of him anymore. She had iguanas.
Interesting.
Do you think he'll make it?
I don't think so at all, because I intubated him and I even just tried to give him breaths of air, but the worms are blocking his trachea. I cannot even get any air into him. His heart rate's only about 20 or 30 beats a minute. He's completely unresponsive.
Oh, man.
I mean, he's going to die on his own, but I honestly think it would be best for him if we put him out of his suffering.
I don't want him to suffer.
This is severe. I'm so sorry.
No, do what you
Okay,
need to
sure.
do now, please. What in the world?
The owners did decide to humanely euthanize him. He was gravely suffering, barely conscious, couldn't even breathe, and was suffocating on these worms.
Oh, I feel so bad. Oh, I feel so bad. It's nothing you did.
I know, but I feel so bad for him.
It's all right. It's okay. Yeah, it's okay. It's all right.
I'm worried for my kids, because the first thing they're going to notice when they go into their playroom is that she's not there. So hopefully they can not have too much of a rough time with it.
Wow, Jessica. Oh.
Euthanasia is never easy. This animal went down so quickly. This is something that was just really brewing. Jessica and the kids really love this little beardie. Never gets any easier, but this is the right thing to do. Never have I seen anything like that, ever.
It's rounds time for Dr. K and Dr. Matt as they check in on Oreo to see if he's strong enough to go home.
So talk to me about Oreo.
Normal temp. Poops are starting to become round again.
That's good.
Tiny ones.
When he first came in, he was doing poorly. His body temperature was below normal. He wasn't eating. He wasn't passing any stool. Those are all really, really bad signs for anybody.
He's been eating the hay almost consistently through the day.
Alfalfa, good. That's what you wanted, huh? He was severely, severely, severely dehydrated. His kidney enzymes were off the charts, and they were in the category of bunnies don't usually live if their numbers are this high. If you think about it, as an adult human being, when you get some gas pain, it can bring you to your knees. When you think of a little tiny rabbit like Oreo, 70% of his body weight is intestinal tract. And if that is all dilated with gas, that's excruciatingly painful. This animal wouldn't want to move, let alone hop over to his water bowl. So it kind of went in a vicious cycle, and he got extremely dehydrated. How's that belly feel today, honey? Oh, that belly feels so much better today. You want to go home, don't you? The nice thing about this bunny is that he's been a phenomenal teaching case for Dr. Grittenbar. Aren't you a good teacher, huh? You're gonna be his bunny sensei. We're gonna refer to him as Oreo the bunny sensei. You are
It's a $1 million bunny.
Yeah, he is. He's feeling a lot better. Oh, look at that. I mean, this is normal. This is so much more normal today. We're happy for you. You get to fly home today, and I'm really happy about that. So he's got a couple things we have to keep him on for the management and his treatment plan, but I think we can safely send this bunny on his way today.
So Oreo has a flight to catch. His owner has been very patient with us, but she's been away from home for almost a week now, and she can't wait to have Oreo back. She's been visiting every day, so I finally think he's well enough to travel. She's flying first class with this bunny.
Rabbit's gonna have champagne and strawberries.
Yeah, right? An in-flight movie. So I'm going to send Oreo home on antibiotics and the same medications he was on in hospital to prevent any GI stasis from cropping back up.
Hey, how are you? I'm so happy with the progress that Oreo has made. My family is all waiting for him. My husband can't wait to see him. He's looking great.
I want to get a picture of Dr. Matt with him. Come here, you. What a stinker. Dr. Grittenbar has had a lot of responsibility with Oreo, which is fantastic.
Are you peeing on me? Don't you do that.
Did he? He says he's marking you.
He's really done well on understanding how to just think differently when you're dealing with a severely dehydrated bunny versus a severely dehydrated dog or cat. Please keep us posted.
We will. We will. Say bye, Oreo.
Wheels up. Bye, guy.
His progress is great. I'm ready to go home. Thank you, and thanks, Dr. Matt. We love Dr. Matt and Dr. K. We met Dr. Matt first, and he was excellent, loving with the rabbit. And Dr. K is obviously so knowledgeable and obviously loves animals. I'm feeling really good. Oreo and I are going home.
Shakira, the diva chicken, and her anxious mom are back with an update.
Oh, hello. We tried to put her in a separate pen, like the doctor said, but she kept escaping. So we really couldn't tell whether she laid the egg or whether a different chicken laid the egg. It is a complete mystery.
Hi. Hi, baby girlfriend. Are you limping still?
She's still limping, yeah.
Oh, gosh. Really? Is your gangster limp? Is that what it is? Back, what you think? My plan is to take an x-ray of her today and just see if it's gone or not, and we can address it appropriately. Want to come out?
I don't want her to have to go into any surgery. I just want her to go home and play with her chicken sisters. So we're hoping that it came out.
I'll bring your backpack. Yep. You want a perch? Yep. Okay, bye, Shakira. Are you a parrot?
Shakira.
Oh, my God. Okay, let's try it again. All right, got her now.
That was funny.
She went for my jugular.
Shakira, that's not nice.
You can prep it, and then I'll tell you when to shoot, okay? Go ahead. You can prep it, and then I'll tell you when to shoot, okay?
Dr. T hopes an x-ray will show if Shakira laid her egg.
What I can tell from this x-ray is she's still very reproductive. You can see her femurs are like bright white, and there's no egg, so. She's so good. She's so good.
She's really a very good
She's
girl.
just like whatever you want her to do. Like, she's like, okay, like for x-rays, like, I swear, she's just like posing no problem. There's no egg. Yay! Sometimes it does take a couple weeks even for the limp to go away, but I feel confident that she'll be back to herself in no time. She looks fabulous, though.
Oh, she's such a sweet little girl.
She sure is.
You should meet her sisters.
I will. I want to see the whole gang.
Well, one day you can come over.
I'll come over and see them all.
Very excited that this ordeal is over. Now my husband doesn't have to worry about his babies. We didn't know what they were gonna have to do. We didn't know what was wrong with her. It was very scary. You know, especially since she's not just a chicken, she's a pet. She's a good girl. Chickens are much smarter than people give them credit for. We're very relieved, happy, and... Excuse me. Ah.
Brody, the baby macaw, returns to see if his bandages can be removed. And this time, he brings along somebody new in his life.
He looks so much bigger. Hi, bud.
I brought in Brody. He has a broken wing. I am fostering him. Armando, the director of the rescue, found me because I have worked with birds off and on for about 12 years. He needs to be tube fed, and I'm the expert at that, so I take him home and I tube feed him, and he's doing really well. He's had a broken wing, so it's been bandaged for a little over a month now. And I'm hoping that today they take an x-ray and that it's healed and they can remove the bandage. He's a lot more active than he was originally. He walks around my house like he owns the place and climbs on everything. He's growing up.
How's your baby?
Good.
Good?
He fell asleep.
Oh, gosh. Can I listen to you? It's okay. I know you're a little on guard. Oh, you smell so good. His heart rate's like 160. Like, that's insane. Usually they're like 300 because you're freaked out.
When he goes to work with me, and he's in an adoption center with like dogs barking all day, and
he's so chill.
People
He's such a
like
chill little bird.
playing with him and stuff, so he's used to it.
You're a chill baby bird. There really is a night and day difference in the change in Brody from when he first came in. He's much calmer. He's gonna be an excellent little macaw.
He flaps his wing, and you see the other one, the whole thing going too.
Oh, wow. So Brody broke his wing, and we've been going through a big series of bandage changes until it healed. And he actually hasn't had an x-ray taken since, and so today's the day. Okay, Brody?
Definitely anxious. He wants it off. He's been picking at it and trying to flap his wing, and so I'm excited to see if he gets it off or not.
I'm just going to briefly anesthetize him. I think he's a healthy baby bird and don't anticipate any risks. And then take his bandage off, and then hopefully that'll be it.
Fingers are crossed.
Yes.
I have 2 children, and they love him, especially my youngest. My 5-year-old is always holding him and cuddling with him, so it's a fun experience.
My God, we're gonna be all done. We're gonna take that nasty thing off. You can go live your life. Do it, Brody man. Oh, that baby. Do Brody. Hey, handsome. Oh, he's
Don't
such a
eat that.
Oh, don't
You
you
eat
do
the
that.
stethoscope.
We talked about this in the room, Brody.
Yeah. Oh, look at that little face. I hope your wing is done.
I do too.
He's getting so big.
I know, he is huge. Can I take this off?
He's gonna feed me. He's going
I know.
into feeding posture.
What you doing, hon?
I'm sorry, Brody. You have to go sleepy bye.
Just for a second, okay? I'm really hoping Brody's x-rays will show improvement. Fingers crossed. Come on. Good boy, Brody.
Like the anxiety. It's just like not knowing kind of makes me nervous. So how is it?
It's completely healed.
Really?
Yes.
I'm so excited.
So excited. So I'm so happy. I think Dr. K made a great call not taking Brody to surgery. We don't want to put him at that kind of surgical risk if we don't have to. And I think he's going to continue to live a very happy, healthy life the way he is.
Brody is doing amazing. He is improving, he's healthy. I'm excited to get him home.